This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Shaun Keating.
Hey everyone, Shaun here. Welcome to another episode of the Dental Up Podcast. Our guest this week received his doctorate in dentistry from Georgetown University in 1986, specializing in custom, cosmetic, restorative, and implant dentistry. Currently practicing from Scarsdale, New York, please welcome Dr. David Furnari, DDS. How's it going, Dr. Furnari?
Oh, it's going great. Nice spring day here.
Oh, beautiful, man. I can't thank you enough. I know how busy you are. We're sitting here waiting. You got a patient in the chair, and it says, hey, you got to take care of those patients. So, man, I can't thank you enough. And, hey, I always start off talking a little bit about sports, man. You into any sports out there in New York? Are you a football guy, baseball, basketball? You like anything?
Well, I like to watch a little tennis. Okay. Rafael Nadal, Federer, and these guys. The Chilich. There's some new up and coming young guys coming on, and I'm a runner myself, so I run and play some tennis.
Ah, beautiful. Oh, that's awesome. What about running? Just like you jog a couple miles here and there, or what kind of running you into?
Generally, I go about 6 miles, 4 or 5 times a week.
Oh, you're kidding. That's so cool. Do you do that in the morning or when you get up or after work? How do you do that?
Usually I do it after work. Usually after work because sometimes I stay up sort of late. So I get to work in the morning, have a good day, and if I get out, at 5:30, 6 o'clock, I just do it in the afternoon.
Oh, that's so cool. Good for you. And man, that's good. I need to get my fat butt off the chair and go at least walk a little bit more. So, it's something, big thing with me in the sports is I always like to start off talking a little bit about it. Right now, we got the NBA Finals coming up. We got the Golden State Warriors going to be in the finals again for the 5th year in a row, and they're going for a 3rd-year repeat. So it's kind of crazy. And Milwaukee Bucks, that hasn't been in forever, and they actually got tied up with who we got tied up with there. The Toronto Raptors, of all things. From the North is their big slogan because they're from Canada. But Toronto, they tied it back up last night, so they're tied 2-2. But Golden State's waiting to play them in the championship again. But so that's kind of the only thing really going on. We got a little bit of horse racing, but I'm not really into that lately. They seem to be dying left and right out here at Santa Anita. And in California, it's like we got like 25 horses that have passed in the last 4 or 5 months, I think it is. It's kind of ridiculous.
Yeah, I heard something about that. What's going on with that?
I have no idea, man. It's like bad juju or something, but it's kind of sad. These horses are such beautiful specimens. I mean, they're just beautiful beasts, and they got all this weight on these little legs and these little ankles, and it's just kind of sad to see them put down like that because there's not a lot you can do once they mess a leg up or something like that. But yeah, it's kind of tough, especially, too, I bet on that first, I'm not a big gambler at all, but that Kentucky Derby, the horse I bet on, it got disqualified, man. I had a big old winning ticket, and they said, no, you're disqualified. And I guess one of the horses that he kind of knocked out of the way went on to win last week. And War of Wills was the name of the horse that won, and that's the one that kind of got blocked out from, the Kentucky Derby. So they're saying, well, everything happens for a reason, but I didn't even watch it. It's just kind of like, All right, enough sports, man. Let's go ahead and dental up. So tell me, Dr. Furnari, why did you get into dentistry, and at what point did you think, I want to be a dentist?
Gee, that's way back, about 30. Actually, I've been a dentist for 33 years, so that's a few years back. But the reason why I decided that I wanted to be a dentist is I was very interested in, liked working with people, and my father was a dentist,
Okay.
but I considered medicine for a while as well, and but I also felt that I liked biology, study of the human body and function,
Okay.
and when I was and by the way, considering the Milwaukee Bucks, I went to Marquette in Milwaukee.
Ah, beautiful.
So I know a little bit about Milwaukee.
Yeah.
But anyway, I was at Marquette University of Milwaukee, and I decided that I wanted to be in the health fields, and it just seemed like my father had loved it and had such a good experience as a dentist, making his own hours and having his own business, that I felt like that was a good path, as opposed to medicine, which I would have been, maybe more involved with longer residencies, and maybe it would be another 3 to 4 years. Because at that point, after college, you can go to 4 years of dental school, and maybe a year or two in the military for experience, and then you're really good for private practice.
Okay.
So that was the path I chose. I was a Navy dentist for a couple of years after I went to Georgetown Dental School. I went to Georgetown from 1982 to 1986, where I graduated.
Okay.
And then spent 2 years in the U.S. Navy Dental Corps, subdivision of Bethesda Naval Dental Command. And then I came to New York.
Unbelievable.
Practice.
I see that, man. And my brother kind of did the same route. He stayed a little longer in the Navy because they gave him a scholarship to go to college. Did they pay your way for college, or is that just a separate thing? You went into the Navy afterwards on your own?
That was a separate thing. At that time they felt they had enough dentists, so the military didn't need to pay dentists or pay people to go to dental school. They had enough people that wanted to get the experience out of school, so they did offer a little bit of time and grade. What they gave me, it paid me a little bit higher since I signed on when I was a freshman in dental school.
Okay.
They said, when you graduate, we guarantee you a position, and we'll pay you as if you've been working already 4 years. So that was the only incentive at the time.
Yeah, I think my brother graduated from USC in 81, and then he went into the Navy, and but they paid for it all. But I think he was saying it was like one of the last years that they did that.
That's right. It's exactly right. Because when I graduated from Marquette in 1982, President Reagan had been elected.
Yep.
Short around that time, and for one of the first things President Reagan did is stop the scholarships for dentistry.
Can you believe that? That's a trip, because in 1980, I was 18 and I was able to vote for the first time, and I voted for Reagan, and they actually gave me a scholarship because we didn't make any money. My mom had 5 kids and single mom, and they paid for my dental technology because of Reagan, and I loved that guy as a president. He was a really good president, but it was good for me for dental technology, but not for good for dentistry, I guess, at that time. But no, that's neat. And then I see that you went to Bethesda, Maryland, and worked off of there. My brother did the same thing. After I think his 8th year, he wanted to get out, and they said, well, dude, give us 2 more years and we'll send you to endo school or whatever. So he did a 2-year gig in Bethesda for his endo training, and so now it's just limited to endodontics for him. But it's a neat thing. I'm a Navy brat myself. My dad was in the Navy 31 years, so we bounced all over. I was born in Roosevelt Roads in Puerto Rico, man. I think they named that after, Rosie Roads, they called it. It's no longer. We went there last year to check it out, and they closed down that big old naval base several years back, and it's kind of a ghost town there. But we were all over Norfolk, Virginia, Bethesda, Maryland, Jacksonville, Florida, Pensacola, Florida, Rhoda, Spain, on, man. Navy brat.
Wow, that's cool. Well, I was lucky to be stationed. It was a branch of Bethesda, but I was actually stationed at Patuxent River Naval Air Station.
Oh, okay.
And Patuxent River is right on the Chesapeake Bay, south of Annapolis.
Okay.
And quite close to the original capital of Maryland, which was St. Mary's City.
No kidding.
And in fact, once a year they have a sailing race from Annapolis down the Chesapeake to St. Mary's City, like an overnight race. They all leave Friday night and arrive on Saturday sometime.
Ah, how neat is that?
So that's another hobby. I do a little sailing when I can.
Ah, you're kidding. We have a big one from Newport Beach to Ensenada, Mexico. They do each year here where I live in Orange County, and it's pretty crazy into Mexico now. Once you get into Mexico, it used to be like hundreds of boats, and now there's not so many because it's getting a little crazy out in Mexico. Kind of well, I won't even get into that. It's just tough, but yeah, I love see those boats going by. I'm more into the motor boats. I got a 54 Bertram.
So you're born in 1962 then?
Yes, sir.
Yeah. So I'm just a couple of years older. So
there you go.
We're about the same age, and last few years I've had a very nice experience working with periodontists from Harvard-trained periodontist Dr. Samuel Lee.
Okay.
You know Sam Lee?
Sam Lee sounds very familiar. I got a lot of guys from Tufts and a lot of guys from Harvard that we work with, but yeah, sounds pretty darn familiar. Is he sinking implants for you, or tell me a little bit about that?
Well, Sam is like I said, a Harvard trained periodontist, and he was a general dentist, and then went back to perio school, and now he's moved to San Diego, California, north of San Diego, and near La Jolla, and he has built a training institute there.
Dude, do you ever go there? You got to come by the lab. We're about 45 minutes from there. I mean, and we got a Dr. Taddy that's right there in La Jolla, right on the water. Her and her dad, we do all their work, and they're just a great practice. But La Jolla, man, that's God's country. It's so beautiful right there on the ocean. They got these big cliffs, and it's just Torrey Pines, one of the big golf course tournaments, is always there.
Right. Yeah, his office is near Qualcomm Arena, near the Qualcomm. Is it Qualcomm?
Yeah, stadium. Yeah, it's like where the Chargers used to play. Now they're down here in L.A., or they're going to be in the new stadium. But
I think there's a Qualcomm conference center. He has a place. And,
yep.
He had some meetings.
Yeah.
So
I think I seen Guns N' Roses there last year.
And but yeah, so I'm anxious to see. I may come out if he invites me again to teach, because I actually recently achieved a California dental license.
Oh, that's so neat. And yeah, we'd love to have you do a little show down here. I mean, we've been doing your work for a long time. I know you work with my Crown and Bridge manager, Jeff, a lot. And he says, man, yes, Shaun, this guy is very specific on his designs. And, you know what you want, and you demand excellence. And we love giving it to you. But no, you're really a really good dentist. And we can't thank you enough, man. And we appreciate it for sure. But heck, you got like 4,000 hours of formal CE, man. I mean, you're a CE junkie, I take. I know. Tell me a little bit about your CE journey, what you like and what you do, and tell me a little bit about that if you could.
Okay. Well, years ago, when I was at Georgetown, after I graduated from Georgetown Dental School, I met a dentist that was teaching there. His name was Bill Lady, Lady. And he had a practice in Washington, D.C. He was one of the guest lecturers that we would have at Georgetown. And when he lectured, he would show a couple things that were special to him. One thing he would show is his dogs, because he had show dogs, and that he and his wife were groomed. And
what kind of dogs? What kind of, may I ask? Were they?
Gosh! Now I'm
French bulldogs. No.
They were large, like Irish setter type dogs.
Okay.
They were big dogs that they took care of. And maybe even a Great Dane. He had very big, large dogs. Okay. Anyway, and then but Bill Lady was a Pankey dentist. He had studied with L.D. Pankey at the L.D. Pankey Institute in Florida, and so I had heard a little bit about the Pankey Institute. So my dad was a dentist and practicing in Scarsdale, New York, and so when I graduated school, I was in the Navy, as I told you, in Maryland, and my dad said, we could go down to the Pankey Institute. Would you like that? And so, when you work in the Navy, you get like 5, almost 6 weeks off a year.
Okay.
So I took a week, and my dad and I went down to the LD Pankey Institute, and I believe it was Continuum 1 that we took.
Okay.
And I'd have to check, but I believe that would have been in 1987.
Okay.
And probably, maybe February or March or so of 1987. So we went to the LD Pankey Institute, and at that time the experience would be for 24 dentists, and they would take 24 dentists at a time and have a 1-week experience.
Okay.
And they would go over complete comprehensive exams and using study models and records and and go over the philosophy of LD Pankey about knowing yourself and knowing your patient.
Okay.
There was a Pankey cross. It was part of their logo.
Okay.
And the Pankey cross, as I recall, was if you had love in the middle, it was be balanced by work and play. Work on the left, play on the right, maybe, well, actually, it was success in the middle. Would be work, play, and then love and worship.
There you go.
And
I was going to say, you got to have the Lord in there somewhere, I'm thinking.
Yeah. So LD Pankey, he had different philosophies. And he would make other crosses, which for understanding. So he'd say, like, for excellence in dentistry, for instance, if you want excellence in dentistry in the middle, you'd have a balance of know yourself, know your patient, have knowledge of your work, and then apply your knowledge.
Okay.
So anyway, we went to the LD Pankey Institute, and it was a really wonderful experience because these are really master clinicians that would use. There was a man there named Erwin Becker who had been studied in Boston.
Okay.
And he was the leader or the permanent fixture down at the institute. And then they would invite another dentist like this Bill Lady or somebody else that was a master dentist that practiced the philosophy. Okay. And then they would have hands-on and presentations. Hands-on learning and didactic, some didactic learning, but presentations. And it was really a great experience. And they had a continuum. There were actually 6 full weeks that they would have that built on each other. And the goal was to teach how to do comprehensive dentistry and to design it, and how to design. One course may have been all about the anterior guidance and aesthetics, and
okay.
another week would be a whole week on, once you have the anterior guidance and aesthetics, would be about how to set up the posterior occlusion and how to do that properly. So that was what they did. Anyway, the Pankey Institute was a lovely place to start and part of my journey. So once we finished, once I did that, I did about 3 or 4 of those while I was in the Navy, maybe 3.
Okay.
And then I said, well, let me wait a year until I get into private practice, because there was a little bit of what they share is how to educate and motivate private patients to want to have the best type of care. And because, some people, they need to understand, everybody can appreciate a Ferrari or a fancy Mercedes-Benz or, that type of thing. But not everybody can appreciate what the difference is between, the best dentistry and average dentistry.
Okay, good.
If people have stuff in their mouth, as long as they can chew and bite, they don't always know if their gums are bleeding or if there's overhangs or if there's issues.
Exactly.
Until things, usually those issues do come back and get them, but they don't realize till later on. So we learned how to help patients appreciate finer dentistry.
Okay.
And that was something that was best done once I left the Navy and came up to work with my father in private practice. And so then I came to Scarsdale in 1989 and worked in private practice here with him for 24 years. And over those years, we went to many continuing education courses, often the Greater New York Academy of Prosthodontics meeting, which is always in New York around the week after
Thanksgiving.
It's around December 7th, December 6th every winter, every fall just after Thanksgiving. Mm-hmm. And that New York Dental meeting is a 2-day meeting where you have prosthodontists from all over the United States and guest speakers come from all over the world to speak about the what's foremost and frontmost in dentistry, which in the last 20 years has been a lot about implantology, digital design, aesthetic design, these type of things. So these continuing education courses are being so close to New York City. it was always easy to get to those type of things.
Absolutely.
And then so I began to do back in even though I had only been out of school 4 years, back by 91, 92. I started doing bone grafts every time I did extractions, because I realized that we were going to be doing less bridges, and we wanted to have people have the opportunity to have implants that were freestanding, that wouldn't have to destroy other teeth to support the missing tooth.
Good for you. That's good, man.
So yes, we started doing. I started doing more surgery, extractions, and bone grafts, and then by 97. I took a course with Richard Kraut, Richard Kraut is a Army dentist who's an oral surgeon, and he was the head of oral surgery at Montefiore Hospital in the Bronx. And so he had a course where he did like a mini residency. He would take 4 dentists for 2, 3, 4 days and do a intensive course in placing implants.
No kidding.
And so you'd go and he'd literally had planned the cases, and you'd go and place 10, 15 implants in a day with him, and you would become proficient.
You do any sinus lifts at all, or no?
Well, yeah. Then once, not in that first course, but from there on, I took other courses and began to do sinus lifts. I learned how to do sinus lifts following some New York dentists. There's a dentist named Alan Pollock, and Alan Winter. They gave a course in ridge expansion, and then Alan invited me to watch sinus lifts, because I referred a couple of my patients to him for sinus lifts, so we could place implants.
No.
So Alan Pollock, who's a member of the Academy of Osseointegration, he was actually the president of that academy. He's one of my mentors as well.
No kidding.
So and then took other classes with other oral surgeons and periodontists. There's a guy named Joel Rosenlicht, and he's an oral surgeon, and Brian Shadoroff is a periodontist. So I took courses with them.
Okay.
And that was all in the late 90s and by early 2000. And then I went on I actually did oral surgery 2 days a week starting 2006. I actually went down to southern New Jersey and worked for a practice that was pretty busy. They had 4 offices, and I did all their oral surgery and implant placement.
No kidding.
For about 4.5 years. So I would drive down Tuesday night and come back on Thursday evening.
It's a trip.
So I would spend Wednesday and Thursday there, and and for a while I went actually on Tuesday. But I spent 2 days a week there, and then come back to work in Scarsdale on Friday and Saturday.
No kidding.
So that was a busy 4 years, but it was good,
A lot of experience, man, for sure. I bet.
Yeah.
Any broken jaws? I got a couple oral surgeons that they actually work on putting jaws together or broken, make sure the occlusion's right and everything like that. You ever do any of those?
Well, no, I'm a general dentist with a strong restorative and periodontal background. And you could say I'm an implantologist, but I haven't been trained to fix broken jaws, so I don't do that.
I'm sorry about that.
That's something I leave for the oral surgeons. but I do comfortably remove wisdom teeth for young people and do that type of surgery. And I went also to some courses and I've joined this group, which I have to mention as part of my journey.
Okay.
I've been a member since about 2009. I went to a course given by Michael Picos, an oral surgeon from Florida, and Maurice Salama. And Maurice Salama is a periodontist from Georgia, Atlanta, Georgia. Okay. And Maurice is part of a group called Team Atlanta. And Team Atlanta, the original 5 dentists of Team Atlanta, is Ronald Goldstein, who is a aesthetic dentist, one of the first guys to do veneers in the 80s. Okay. Ronald Goldstein and David Garber, Boston. Came from Boston. I think Harvard trained as well. And so Ron Goldstein, David Garber, Henry Salama, Maurice Salama, and who was the other one? Sorry, probably missing one. but there's 5 guys down Atlanta that are part of that group. So they all moved from the Northeast down to Atlanta back in the early 90s.
Okay.
And they have a group now. So in 2011, Maurice Salama had this vision of starting a group called Dental XP, and that stands for Dental Experts.
Okay.
And they have online learning, and they have videos of many types of implant surgeries, sinus lifts, ridge expansions, block bone grafts, anything you can imagine. They have it on the Dental XP website.
We'll put that on our show notes. So, because we have a lot of younger dentists looking for different CE, and this is some new stuff that we haven't heard here on the West Coast, or maybe people have heard about it, but I haven't really heard of it. But you're a master. You're doing really good. So whoever you learn from, you learn good, because you really are crushing it, and you do practice great dentistry, and you know what you want. You're very particular and specific on designs if it comes to metalwork and everything else. But we appreciate that. But no, that's neat. Keep going, baby. What else you got? What else did you do? I know that you're a big guy utilizing 3D scanning technology. Tell me a little bit about where you learned about that and what your thought process is with the 3D imaging.
Well, at this point, we're using the CAT scan for all our evaluations of third molars and wisdom teeth, and for treatment planning for implants.
Okay.
We do not, as of yet, we do not have an intraoral scanner in the office for scanning within the mouth.
Okay.
But we can digitize any good, well-made silicone impression. We often make custom trays for those impressions so that we have good accuracy. And there are intraoral scanners where the labs can scan and even 3D print models from those fine impressions.
Absolutely.
But certainly having the instrumentarium OP300 to full 8x15 scanner has allowed us to really see ahead of time, most of the time, exactly what size implants we're going to need, where we need bone, where we don't have bone, and it's certainly a good way to evaluate the success of our sinus lifts afterward.
Oh, absolutely.
In fact, one of the things that's been very interesting that I learned with Dr. Sam Lee, we were teaching in Chile and China, and one of the things he started to do is some tunnel grafting. Now, I've done some, we would call it subepithelial connective tissue grafts through a tunnel. And that means it's a minimally invasive technique where we just make a tiny, some people call it pinhole technique. Okay. We make a tiny opening in the mucosa, and we use very specialized instruments to lift the tissue and to graft under the tissue. Now, most of the time, one of the people that pioneered this technique is named Edward Pat Allen. Okay. He's in Texas, and you may have heard his name. He's also on Dental XP as well. And so Edward Pat Allen is somebody I learned to do the tunnel grafting from. Okay. And when you're doing a tunnel graft, you need to do a special release technique to releasing the periosteum. What the interesting thing about this is that traditionally you would take tissue from the roof of the mouth and use that, but there's only a limited number of tissue you can get from the roof of the mouth, limited volume. So Edward Pat Allen has used Alloderm, which is made by BioHorizons. Okay. And that's human tissue that's been denucleated and washed and freeze dried. So you can take that tissue, and we can use that in the tunnel to bring gum tissue back. Just like you pull a window shade down, you can bring the gum tissue back down to cover roots and things.
Oh, that's so awesome, man!
So so now we've taken that a step further, and we can actually do bone grafts through the tunnel, and that's really been quite interesting technique that we've learned, and I learned that with Dr. Lee. So we're able to go through the tunnel, slide a small membrane into the tunnel, and place bone, like a rhabdose mineralized bone, into the area. And in some situations, we're able to bone graft around teeth under a bridge before a bridge is replaced. In one situation, most recently, that allowed us to remove a 6-unit anterior bridge that was from 6 to 11, and we recreated bone under there before we removed the bridge, so that when we did remove the bridge, we were able to place immediate implants, 5 immediate implants, and immediate provisional for that patient.
Oh, that's so huge. That's awesome, dude. I really love hearing that. That's some technical stuff, and you just think sinking an implant, it's real easy peasy, but no, there's a lot to it. And, even just your basic grafts to be able to, accept an implant, but to go above and beyond to really do things beyond just a simple graft. I mean, you got it down. So I know you got a surgery coming up. I know you got to get off, but what kind of advice can you give some of our newer dentists starting off? Maybe some do's and don'ts, some advice you could give us real quick.
Wow, that's tough. So real quick, definitely, don't realize that when you're just graduating, keep your eyes open, find something you like to do that interests you, okay. And whether it's orthodontics or surgery or implants, find something you like to do, and really realize that it's just the beginning of your journey, because it's a lifelong learning experience. And I've been a dentist for 33 years, and just you just never stop learning, because if you once you think you've arrived, then it's over. You got to keep learning and keep moving forward. And the other thing is that I would advise them, the really key thing is they need to look at the demographics of any area they wish to practice in.
Yes.
Because unfortunately, I don't like to end on a negative note at all, but unfortunately, there are very areas that have been densely populated with
1,000 dentists in every
schools,
corner.
Too many schools or too many dentists in one place,
yeah.
And that with the combination of the private equity. Trying to make big companies turn into, make these dental mills.
Yeah.
These are things that are not good for dentistry. And unfortunately, they've created an oversupply, and then the dentists aren't appreciated as much as they should be. So they need to check demographics and look for an area where you're going to have people that need you.
Yeah.
You're better off living in a area where there's people need dentists, but they don't need a lot of dentists in the middle of Manhattan.
Yeah, exactly.
So you want to start in a place where people need you, even if it's possibly another country.
Absolutely.
You have to consider that.
Now we
got. So those are my two things. Never stop learning, and always check out your demographics before you invest in an area.
Words of wisdom, baby. Hey, thank you so much. How's my lab doing for you? We doing okay work for you?
Your lab is doing fantastic work for me, and I love working with Jeff Sugimura and Steve Tappy. You guys are very responsive and send me pictures, and so I can check the details and the progress on cases. And you guys are fantastic. And I look forward to being able to come out to California and meeting you in person. And certainly going to look you up and speak to you next time I get there.
Thank you so much, Dr. Furnari, and I can't thank you enough. God bless you and your family. And, man, if there's anything I can ever do, please let me know. But, again, thanks again for coming on the Dental Up podcast, and we'll talk to you real soon. All right, baby.
Thank you.
All right, man.
Bye,
Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.